Okay, good. So, good morning. My name is Dr. Salima Hamouche. I'm Assistant Professor of Human Resource Management at the Canadian University, Dubai. I'm happy to be present with you today. And I would like, first of all, to thank Tisch International University for this invitation, and mainly Dr. Ahmed for organizing and also coordinating this, this special event. I would like also to thank you for your presence. So today I will talk about the impact of COVID-19 on employees' mental health, presenting insights into organizational interventions. So it's mainly from a human resource management perspective. So let's go. For sure that in terms of context, COVID-19 don't need any introduction. We are still living and facing this this challenge. It's an unexpected event for sure, and organizations were not well prepared for it. Actually, not just organizations, but all individuals all over the world. So, yes, Dr. Mohammed, can you hear me? Yes, the voice is clear. Good.
This is very clear. We can hear you very clearly. We are listening to you, right?
Okay, good. Thank you. So, so in terms of some statistics or information regarding the impact of COVID-19 on individuals' mental health, we have the nationwide survey of psychological distress in China during the COVID-19, showing that almost 35% of the respondents experienced psychological distress. So for sure that the objective of our research, and actually if I will just introduce it, when I have started writing this paper, it was at the very beginning of this pandemic. It was even before that the WHO announced that it's a pandemic. When we speak about the COVID-19, it was early in March. So when I have started working on this topic, there was really very few studies on the impact of COVID-19 on employees' mental health. But what I have really considered is that organization can mainly focus on the sustainability of the organizations, and then employees' health or mental health mainly can be overlooked. Especially nowadays, we speak mainly about a risk of mental health pandemic. So why? Because of as a consequence of the COVID-19. In terms of research objectives, so the first objective was mainly to analyze, investigate the impact of COVID-19 on employees' mental health, and specifically we focused on the psychological distress and depression. But for my presentation, I would mainly focus on the psychological distress. The main risk factors, so to identify the main risk factors during and also post-COVID-19, identify also the moderating factors in the relationship between COVID-19 and the employee's psychological distress. And also to identify some recommendations from mainly a human resource management perspective in order to help and support organizations, and also to be able to really prevent these mental health issues in the workplace and protecting our employees in general. Good. In terms of methodology, what I have started at the very beginning, we needed really information about this main issue, this main topic. So I have opted out for literature review. I have collected papers mainly from Google Scholar, Web of Science, PubMed, and I have used the Boolean search mainly with the keywords in order to really collect the proper information regarding this topic. The search was done manually, and the articles were mainly between December 2019 and July 2020. Here, for sure, that with an update of the literature. So what is psychological distress? When we speak about psychological distress, here we refer to a mental health outcome. So typified in terms of definition by psychophysiological and behavioral symptoms that are not really specific to one particular mental pathology. So it may include symptoms of anxiety, depressive reactions, irritability, decline of intellectual capacity, tiredness, sleepiness, and also we speak about negative emotions. So with simple words, when we speak about psychological distress, it's really a set of negative emotions, if they are not treated or they are not identified, they can lead to much more complex cases of severe depression. So on a continuum of mental health issues, the psychological distress is the starting point of these problems. So when we speak about psychological distress, and mainly when we link it to the workplace, here it is related to the stress. It's an outcome of stress. So, and when we define stress here, we refer to the incapacity of the individual to face the requirement of his environment or her environment. So in general. So here, since we speak about the workplace, we refer to the occupational stress. So in this context, the individual has not the resources or is not able to face the requirement of his environment at work. And if the stress is intense, if it is repetitive, if it is chronic, this will lead to a high level of psychological distress. So the psychological distress is the result of this stress. Good. So let's see now what are the main stressors. So the main stressors that we have identified, and for sure that in the workplace, there's a lot of stressors, speaking about the work demands, speaking about the lack of recognition in the workplace. So we have these predominant models. So for today, I would just mainly focus on the stressors that we can relate to the COVID-19. So what we have identified, mainly the first one is the perception of safety, threat, and risk of contagion. So for sure that when we speak about COVID, it's in the known, especially at the very beginning, we didn't have enough information about about the situation, about also the contagion, about the COVID-19 itself. So this really creates a high level of stress because of this perception of threat and also the risk of contagion. And this may lead individuals to develop dysfunctional behavior. And we have seen this actually in different countries where this shortage in sanitizers and masks. So this fear has really increased, and this is due really to this unexpected and the new situation. So the other stressor is the info obesity versus what? The unknown. So with the COVID-19, for sure that we have a high volume, high level of information. So that's why we speak about an info obesity. So we have a lot of information about the COVID, so nonstop information in the media, nonstop information in the social media. So this may create what? A high level of stress. Why? Because there's no consistency between among the information that we receive, which is related to the fact that it is an unknown situation, a new situation. The other point is that there is a conflictual information also in the social media. So this may bring what? A high level of stress due to the volume of the information, plus also the ambiguity that was also and also still present, even if after this the development of vaccine, but still we have a lot of information surrounding this this pandemic. The versus one is what? Is the unknown. It's a new situation. No one is really able to say when it will end. That's why some authors, they refer to the endemic instead of pandemic. So we don't know when this will end. No one is able to predict it. So the fact that it's new, so this will also create what? A high level of stress. We have also physical distancing and quarantine. So here for sure that we have in all countries all over the world, there was the lockdown. There was also a situation where people were isolated. People need still to respect the physical distancing. So people were quarantined. So what this brings really a social isolation of the individuals with a high level of stress. At the very beginning, some studies show that at the beginning, when it has started, the employees was the level of stress was not so high. Why? Because the employees had the time to spend time with their families while working from home. But with time, this has really increased. Okay, so for sure that the physical distancing create a new functioning, even in the way and the interaction with other individuals. So you need to think prior to move. You need to think prior to have any interaction with your friends, with the family members, with your colleagues. people were mainly isolated. Why? Because they work mainly from home, and even if in a personal context, they need also to calculate and to think about the risks prior to move to visit their families. So this has also created a high level of stress. The consequence also, or the also it is considered as the stressor, is stigma and social exclusion. Stigma and social exclusion in this context, for sure that when there's fear and the stigma is recognized and have been highlighted in the literature as an outcome of a situation of pandemic. So here, the fear of people, generally individuals, they will look for someone or individuals or group to take really the burden of the whole situation, that they can really avoid people, especially when we speak about individuals who are related to the epicenter where the pandemic has really started, or individuals who are in direct contact with the risks of contagions, like for example the frontline workers. We speak about healthcare workers. So this creates what? The fear of people. In a way to protect themselves, they will create a stigma, and this will lead also to stereotyping, and the burden or the high level of stress will be among people who are victim of this situation, who are isolated, that people avoid. So for sure that this may lead really to a high level of stress. When I speak about the stressors related to stigma, it is not just related to the period of the COVID-19, but even if after this period, this may stay and this may remain. Why? Because of the shock that some people has really faced or lived during this psychologically demanding period. We have also financial loss and job insecurity, which have been also identified as stressors. So for sure that if we link it to the economic impact of the COVID-19, there is a high level of unemployment rate. Many has lost their jobs. There was also reduction of working hours. There was also an impact on the compensation. So the salaries has decreased, even for some people who have been able to retain and to maintain their job. So they had no choice just to decide that to reduce the working hours. So consequently, this has an impact on also their compensation in terms of salary. Same thing also, there are some people, they may continue working, but still they have this reduction in terms of salaries. So this financial insecurity creates a high level of stress, because first of all, most of people, and let's say all of people, were not prepared for this events, for this unexpected events of this pandemic. So for sure that there was no saving, like people were not like prepared, they saved money for this situation. So this, for sure, this financial loss creates a high level of stress among families, and with possible also consequences and we have witnessed this, and we have seen this actually in the literature related to the violence among couples and families. So this creates really a high level of stress and may lead really to really severe dysfunctional behaviors. We have also the job insecurity. In this context, it may be related mainly to people who have not lost their job position, but who are in organizations which have decided to really go with layoff. So they have seen a high level of layoff, especially we have in some sectors like retail, like tourism, hospitality, for example. So this may create a feeling of job insecurity. So the employee will think that he is the next on the list. So the other point is that for employees who are in certain sector of activities, like for example, that requires the physical interaction, for example, we have all the restrictions in travel, we have all the restrictions also in restaurant and in hotels, tourism in general. So they will feel that because they are in this sector of activity, that their specialty is in this sector of activity, this will create also a high level of stress due to this feeling of job insecurity. What are the moderating factors? So what we have identified, and mainly based on the literature review that we have performed, we have three main types of or categories of moderating factors. We can speak about the individual factors, the institutional one, and also the organizational factors. When we speak about the organizational factors, here we can refer to the occupational role. There are some job positions, they are already before the pandemic recognized like high level of stress. For example, when we speak about healthcare professionals, the healthcare professionals in general, we recognize that they have high level of work demands, very often low level of work control. So plus with this pandemic, and they are at risk and in contact with people who are at risk of this contagion, this may increase the level of stress among these employees. So the occupational role plays also yes, plays also a crucial role in this context. So it may intensify the impact or the effect of the stressors that I have mentioned before on the employee mental health. The other also organizational factor, we can speak about the organizational policies regarding, or the programs also regarding safety and health in the workplace. Some organizations, they have already these programs which are developed. For example, they have the employee assistance program. They have also all the insurance. They have clear steps, clear program related to safety and health. This may lead to what the employee will feel that he is supported, he is protected, he has all the tools from the speaking about psychological risk or physical risk. But the absence of these measures in the workplace may lead to what? A high level of stress. Why? Because the employee will fear if he has to go to work or to be physically present. Second point is that if he is at risk of any psychological issue and there's no policy or program developed in the organization, this will intensify the impact of the stressors that I have mentioned on his mental health. The other factors are the institutional factors. Institutional factors here we refer mainly to the support that the government provide to organizations and also to individuals. At the very beginning of the pandemic, there were programs to different countries to support employees. So there are programs to support employees who have lost their job position. There are programs to support also employees, and for example, in Canada, there were also an intervention from the government to really support employees in their development of new skills, which will help them to find another job position if they have lost their job position due to the COVID-19. There were also a lot of programs which have been developed in many countries, for example, here in UAE, or also in Canada or in US. So we have programs that support companies. So especially when we speak about SMEs, and this is the main topic here in this workshop. So these programs for sure can protect and can support financially the SMEs in a way to also be able to retain and maintain the job position, and also to sustain their business. We have individual factors. Individual factors, we can refer to the socio-demographic factors. So if we speak about gender, if we speak about age or education. So if we speak about gender, in the literature on mental health, generally what we can find is that women are more at risk of developing mental health issues than men in the workplace for many reasons. We have the stereotyping. We have also the fact that there are factors related to their personal life. So we speak about the work-life balance. Also, when we speak about women who are in management positions, the fact that we speak about the glass ceiling, all the obstacles that women may have to face in the workplace. So in general, if we take into consideration the stressors that they are facing, the same stressors as all the other employees, but they have plus stressors, so additional stressors, which are related to the stereotyping and also the work-life balance. So the other point also that when we speak also about women, there is also the women who can be at risk are the pregnant women, especially in a situation of COVID. So high level of stress, being also pregnant, being afraid of the contagion. So this may also lead to a high level of stress, which will intensify actually the effect of the stressor that I have mentioned on the employees' mental health. We have also the age. Okay, so in terms of effect, the moderating effect, if we link it to the COVID-19, we recognize that the old people are more at risk of having really are more at risk in terms of health, physical health, when we relate it to the COVID-19. So this may create a high level of stress among these people. Second, among old people, speaking about old individuals. Second point is that with the old individuals, we can also mention that not all of them are can use the new technology. So when we refer to the quarantine and we refer to the social distancing and the lockdown, they were really isolated because many of them they don't know how to use the new technology. So this has created what an isolation from the members of the family and also a frustration toward the use of the new technology. The other point is that if we refer to the job insecurity, we see that it is challenging for an employee who is old, who has reached a high level, actually in terms of experience, in terms of job position, to look for another job position, especially in these circumstances. So it can be also challenging, putting their health, their psychological health at risk. We have the education. Education here plays a buffer effect, has a buffer effect on this. So when the individual is highly educated, so he will know more about how to understand the situation and also how to apply the measures and why these measures are required, plus also the competences related to the technological competences. Now, let's go to the interventions. What are the main interventions that we have actually identified and recommended in our paper? First of all, we have the communication and transparency. In such situation with an info obesity, when coming from different sources of information, it's really important for the organization to really create a partnership with the health institutions, government health institution, to have really the exact information about the current situation in the country, plus that will have an impact on the organization. This is one point. When with the communication, a clear one, transparency regarding the organizational plan. This will help to reduce the level of stress of employees. They will know about the planning in terms of functioning in the organization, the future plan of the organization, what the organization intend to do, what will be the impacts. They will understand also how this will function and what will be the impact on them as employees. Second point, it's really important to involve them in this process. So communicate, give the proper information, the complete one, based on what you have as information, and also to involve your employees in this process. This transparency will reduce the level of stress, and also they will be aware about what they can expect in this situation. We have also the prevention of stigma, so which is really crucial in the organization, especially nowadays, but also after the pandemic. Why? Because this will prevent any situation of violence or in the workplace. This will also help to actually create a healthy work environment. And the main prevention will be the zero tolerance policy toward any behavior hurting people within the organization. So zero tolerance towards stigma in the organization. Explain what is this phenomenon. Explain also what are the expected what are the behavior that needs to be avoided, and also in order to be able to create this collaboration among employees. Prevention of stigma will go also with the communication. When generally people avoid other people, why? Because they don't know much about the situation. So ignoring or the fact that they don't have really a clear information about the situation, they will just look for given or putting the burden on other people. So that's why it's really important to increase the awareness about this situation. We have the training. Training will help a lot with increasing the awareness about the importance of safety measures, about also how to work from home, about also what are the main impacts on the psychological health. So when we explain actually what the employee can expect, the fact that the employee will know that there is a risk on his mental health, he will recognize the signals and he will be able to ask for help and support in the organization. So the other point is, the point that I haven't mentioned when I have talked about the organizational factors is the remote work. The remote work nowadays, it's we speak about the new normal. People are working from home. Most of people are working from home. So for sure that in terms of factor, it can represent a high level of stress. Why? For many reasons. First of all, we have the fact that there is no clear boundaries between when we speak about private life and professional life, a risk of disruption while we are working, especially if the employee has kids, living with the family. It depends also on the size of the apartment. So all this plays really a crucial role. The other point nowadays is that we speak also about an info obesity, in which sense we speak about receiving a high volume of emails. So the fact that working from home, people use mainly to send emails more than while they were working physically in the workplace. The other point is that we speak about presenteeism. And with the presenteeism means that with the remote work, the individual may feel that he needs to show that he is working. So he needs to stay longer time, even if he has already completed his work. So this may also lead to high level of stress. But going back to the interventions, we need really to create clear policies in the organization about what is expected in terms of functioning. Clear also goals to achieve. Creating also situations to interact virtually. So a virtual group and virtual meeting, not just for formal meeting, but it can be also some event created by the colleagues, just having coffee online together with the employees. This will create what? This will help to help the employee to speak about possible mental health issues, possible difficulties, because it's not easy to speak about the mental health issues. And this will also help the employee to know that there are also other people in the organization, perhaps they are facing the same challenges. So they can talk, and the events have not just to be like formal one organized, it can be also informal. Social support, consistent with what I have presented. Social support, very often in the literature, we refer to the social support coming from the supervisor. But we need just to take into consideration that even the supervisor is a human being, and he is also at risk to face a mental health issue. That's why we need really to clarify that the social support can be formal in the organization, but by the employee assistance program that needs to be open, not just to employees, but also to managers. This is one point. The other point is that the social support can come from colleagues, can come from the supervisor, and also it can come from the team members toward the supervisor. So, and we have also the return to work. For sure that there are some job positions that cannot be performed from home. So it's really important to plan for the return to work. And for sure that not all people will stay forever working from home. The organization needs to decide who are the employees and what are the job positions that need to be performed from home. We can continue to maintain it like this. And what are the job positions that require the physical presence in the workplace. So in this context, you need to plan the return to work. You cannot just decide like tomorrow you will just go back and to start work. No, you need to start planning for this return to work, involve the employee, talk to the employee, and also identify if there's any risk for the employee. Why? Because perhaps the employee has been also facing really real high level of stress or challenges related to this COVID-19. Perhaps he has been really like a victim of this COVID-19. Perhaps he was sick. Perhaps he has faced many difficulties, extreme difficulties with in his private life. Perhaps he is not able to return yet to work. So that's why you need to have this discussion between the employee and the manager in this context. Yeah, so in terms of limit of this research, we speak about literature review. So for sure that when I have started working on this paper, I wanted mainly to collect the information about the impact of COVID-19 on employees' mental health in order to provide some insights for the organization that may prevent this this situation. So it was the best tool at that moment to go for this literature review. In terms of for sure that this paper can give some also insights into future research. We can go with quantitative analysis just to test the relationship between variables. We can also go with the development of any test of moderating effect in order to really go with testing these the impact of these variables or factors on the employee's mental health in terms of future prospect. In conclusion, I would just say that in order to prevent this mental health pandemic, we need really to take into consideration the mental health of our employees. We need also to make sure that we develop the proper programs. And for sure that just to conclude, it can be challenging for SMEs. That's why it's really important for these organizations to create this partnership with government and also institutional institutions, and also involving their employees in this context. So this is for my presentation. The reference for my article is this one. It is published actually in the Emerald Open Research, and my contact number is this one. Thank you for your attention.
Thank you very much, Dr. Salima Hamouche. Actually, it was really great. An informative presentation. We learned a lot from your presentation, surely. There are a lot of questions. Actually, I don't know which one to start from. But
okay.
Let's start from the one that Assistant Professor Asma Khalid has asked. Yes. She says, which moderating factor negatively affected the stress behavior in highly sensitive areas?
Okay, I will just take note of this question.
Yeah.
So which
factors they moderate in order to reduce, the stress in a highly sensitive areas or highly sensitive, I think she means jobs. Job positions. And let me ask one more question. It says, how do you see the employees' stress caused due to the COVID-19 in less developed countries? And I think it means, that means like developing countries and the developed countries. So what are the stresses based on the country's position, or the being developed or developing country? Okay. And let me ask the last question, because there are a lot, but I think we don't have time.
Okay, let's go with the first, second, and then you give me the third one, just to make sure that I will remember them. Huh? Yeah, okay, sure. So thank you very much, Dr. Ahmed. So, and thank you very much for the doctor that who has asked this question. So for sure that in terms of moderating factors in highly sensitive job positions. Highly sensitive job position, what we need to understand first is that to identify the risk factors which are related to the job position prior to this pandemic. This is the main point. We need to understand in a normal time what were the risk factors. As the example that I have provided is in the healthcare system. We know that a high level of demands, they face also high level of violence in the workplace. For example, as an example, we speak also about the level of resource. So when you don't have enough resource, you cannot have enough control on your workplace. So in terms of moderating factors, for sure that you need to provide, you need first of all to identify the risk factors before the pandemic. Then you need to analyze the situation during this pandemic now. And in terms of moderating factors, what you need to include is really to give the social support to these employees. Why? Because they are really overwhelmed by this situation. When we speak about sensitive, means that they are perhaps at risk or they have a high level of job demands. So you need really to take into consideration the social support, which plays really a crucial role. The other moderating factor, we can also go with the recognition. The fact that, yes, thank you, recognize. It can be also translated toward compensation. Because if we just compare the normal compensation with what the highly sensitive job positions are facing, it's not the same. It's not the same environment. The other point is the control over the job. So it's really important to give the proper resources to the employees who are in these job positions. And the other point is just you need to identify all the individual factors that may really create this variation or difference from one employee to another. But definitely in high sensitive job position, we need really to provide the support. We need, it will play a buffer effect. The other point is also to go with the recognition and also to have an intervention on the job demands. So when we know that if there's a high level actually of job demands, we need to have an intervention on this. I hope that it answers your question. So this is for the first question. Now let's go to the second one. Second question, actually, we speak about the stress in mainly developing countries. So in terms of differences between countries. For sure that when we speak about mental health issues and also the programs, the practices that have been developed, we will see that it is much more developed in developed countries than developing countries. So why? Because of probably the resources also available, but also at the same time, if we speak about the pandemic, we have also the impact of the country culture. The culture also plays a crucial role. I just close this, sorry. Yes, the country culture plays also a crucial role, because and for sure that I will not just go with the Ofsted model and so on and so forth. I will not go with this development, but the awareness, this can be challenging also due to the country culture. For sure that if people use to be in the interaction, they are really close to each other. If we are in a collective country culture, so what happens when you implement the social distancing and you ask people not to really respect a certain distance? It can be challenging. They don't use to really function in this way. So imagine if you apply it also in the workplace and explaining that it may have an impact. I'm just talking about the physical health. It is already just challenge at this point. So imagine that we speak about the mental health. So for sure that in some cultures, perhaps the stress is considered as normal. But that's why we need really to take into consideration these differences in terms of culture that can be challenging mainly for multinational companies. So let's go with the third question.
Yeah, thank you very much for your answers. Let me ask the last question, because really there are a lot of questions that we don't have time to ask all of them.
No problem.
Okay, the last one, actually, this question is good. Like it says that, is it possible that stress affects the employees in the governmental, positions and the private positions? So that, in the government positions, the employees are already having their salaries monthly. You have also already discussed about the financial security. But the employees who are in the private sector, so that they have to secure their finance, especially when they're having their own job. Therefore, what are the stress levels on that, both how they would how it would affect them, in shortly? Thank you.
Okay, good. Thank you very much to the person who has asked the question, and also Dr. Ahmed. So yes, for sure that the stressors may vary based on the sector. So if we are in the private sector or we are in the public sector, the stressors can differ. Okay, so for sure that when you speak about private sector, the reason is what the main goal is profitability, to really generate profits in the organization. So, but in the government sector, it's different. So yes, if we speak about employees in the public sector, they can they can keep their salaries, but for sure that in some job positions, there in some countries there was also a cut in the working hours in order to optimize the functioning during the pandemic. The other point is that they work from home. So they can have also the stressors that I have mentioned, working from home, being isolated. The additional stressor that you cannot find in the private sector is the fact that with in the public sector, employees work on a specific political program that is already identified in advance, and they need to apply it. So this may have an impact on this decisional latitude. So you agree or not, you need to apply it. If you are in management position, if you are an employee, your role, if you are the interface of the organization toward the citizens. So here in this context, just to what you need to take into consideration, we can go with all the stressors that I have mentioned, except probably if we go to the private sector, if we go to the sectors highly hit by the pandemic, like for example tourism, like for example all what is related to travel. So for sure that it is not the same impact, but still, even employees in the government sector, they can suffer from the stressors related to the social isolation that can be generated due to working from home, so mainly the remote work.
Thank you very much, Doctor.
You're
may
welcome.
I ask one thing? Is it okay if you could share your presentation with me? I think they're asking a lot if they could have their presentation as well as your PDF of your, the work, so that they could maybe cite with their works they're doing it in the future.